One of the most important class today, because we always come across with hypertension. That's a very common thing. Being a doctor, one has to have a stethoscope and a sphygmomanometer, which are always ready with the patient. That gives an impression to the patient also that yes, this person is really a doctor. Nowadays a doctor means one has to have a stethoscope. Stethoscope reflects and it tells that the person is a doctor or not. So likewise, why we have to go so much deep or depth in this aspect is because as we have started cardiovascular system, so we have continued the electrophysiology of the heart. Again, I'll repeat the electrophysiology of heart when we go with antiarrhythmic drugs. Arrhythmias means a rhythm. Rhythm should be maintained. The cycle of cardiac should be maintained because one impulse comes, then the next impulse again repeats. Likewise, the whole heart contracts and relaxes. So that rhythmicity should be maintained. And the speciality with the heart muscle is different because it has automaticity, it has contractility. So these are the special characters of the heart muscle. The heart muscle is the only muscle which is present in heart only, apart from all our body, because our body is made up of 4 types of tissues. In that, one tissue is our heart muscle, which is only present in heart. So with that speciality, because once from the first month of our embryo, once the heart starts beating, it will go till the death of a person. So that much power one has to have. Like heart cannot become a lazy. So like how we are doing our work. Adi sir bataya aapko कि yes, go with that. He has told S10, A3, F1, VER1 and YE. What we could not remember that, but heart never do that mistake, and it will do its work. So that work is because of its automaticity, that is pacemaker, that is SA node. There are 2 types of muscles or cells heart has. One is the conducting cell, another is the contracting cells. So because of the contracting cells and because of the electricity which is generated by its own, that is why it is called automaticity. So that's why the heart is working. Commonly when we talk about cardiovascular system, we talk about heart and also we talk about blood vessels, because the blood has to pass to each and every part of the body. So heart, we can consider it as a bigger vessel. It's a bigger vessel where some pumping system is there. Something is input, process and output. Same like computer. In, process and out. So in is from veins, the blood is coming, and process means it has to get an force to get into all parts of the body. So that is the output, from where the stroke volume, whatever we get, cardiac output is delivered to all parts of the body. When it goes to all parts of the body, there are again, to flow the blood, there is a resistance. There is something which opposes for the blood not to flow. Because with the pressure, blood has come out. But there is some opposing forces. So that is called resistance. And it is called peripheral resistance. So due to this peripheral resistance, the blood is difficult to pass. So as the peripheral resistance increases, the flow decreases. It is inversely proportional. So once when the blood has come to the blood vessels, it has to pass to different parts of the body. Once it reaches to blood vessels, so it has to maintain its elasticity so that the blood has to pass. So one is, it has to dilate to its maximum diameter so that the more blood should pass and maintain the resistance. These are the 2 factors which opposes. As the age passes, person will get hypertension means what? The tension in the blood vessels. What is the tension? There is a lateral pressure which is exerted on the walls of the blood vessels. So that pressure opposes the blood, but blood has to go. So because of the increase in force, once the blood goes, then the arterial valves gets constricted. As it constricted, the hypertension will be the common cause. So when we say the pressure, blood pressure, it has to maintain. It should be normal. It should not go high or low. But in this case, what happens? There is maximum pressure which is exerted on the walls of the blood vessels to pump the blood, so there will be vasoconstriction. So we have to have, when we know the physiology, we will go with the drugs so that how to maintain the elasticity of the blood vessels, first factor. So we can make a drug so that the elasticity should be maintained, and we can give a drug where the resistance should be nullified so that the blood can go smoothly. So by considering these two factors, and the drug should act on smooth muscles, very very important this, because all our blood vessels are smooth muscles. So how to go with this? So we will go with today's class. Okay, just a brief introduction about blood pressure. Okay, so as we know, hypertension, hyper means more and tension is the pressure. So pressure more in the blood vessels. So elevation of systolic and diastolic blood pressure are the hypertensive. It is called hypertension. What is hypertension? Hypertension is the elevation of systolic and diastolic blood pressure. What is systole? Systole is the contraction of heart, and diastole is the relaxation of heart. What is happening with the pumping organ? That reflects the blood which is flowing to all parts of the body. So the reflecting thing is two things. One is systole, another is diastole. That is from the pumping organ. So hypertension, if there is more contraction or if it is more relaxation, in turn affects the blood pressure. Okay. Now we will see there are basically two types of blood pressure. So the one is the primary hypertension, and another is the secondary hypertension. What do you mean by primary hypertension? Primary means whatever the thing which we say, the initial thing is called primary, right? It is also called essential hypertension. The primary hypertension is also called essential hypertension, and it is also called idiopathic hypertension. Why we say idiopathic? Idiopathy means where the cause is unknown. Usually the maximum number of cases where we don't know the cause. Without having any cause, a person may also get hypertension. As I said, the age is a big factor. Nullifying that, if we say that without having any reason, if a person is getting blood pressure, then it is called primary hypertension. And secondary hypertension, where the cause is known. We know the cause. So what could be the causes? There are many causes which are related to hypertension. The first is the kidney problems. If a person has kidney problem, surely he may have hypertension. And if the person has hyperthyroidism, also blood pressure increases. So we know the cause. Doctor will ask, he will say, yes, go with TSH, T3, T4. And if he find that there is decreased amount of T3, T4 or more TSH level, that means it is hypothyroidism. And in turn, if it is opposite, then he will say that it is hyperthyroidism. So if at all, if it is hyperthyroidism, he will not give for blood pressure medicine. He will treat first the hyperthyroidism, then he will go with the treatment for hypertension, still to nullify that. So a good doctor, where if he finds that there is a patient who has hypertension, that means we should not go with the drugs. A good doctor is one who will never go with the drugs when a person comes with hypertension. First we will see the type of hypertension and by taking the history of the patient. With the history, one can say whether it is primary or secondary. Then he will make it continue for minimum 3 to 1 week, seeing the blood pressure morning and evening. After checking, taking the average of that, then only he is considered to go with the drug for hypertension. Okay, and now next is even adrenal gland tumors. You know what is adrenal gland? Yeah, the glands which are endocrine glands, which is present on the kidney, that is adrenal gland. There are two types of main gland cells which are called nerve cells, which are present other than CNS. These are the nerve cells which are present outside the CNS. So this is very important thing. Being a doctor, we can say about this point, where even we can challenge any other pathy doctors that even electropathy doctor is soundful in physiology. How? Nerve cells means it should be in brain and spinal cord, right?
Yes.
Apart from that, peripherally, all the neurons or nerve cells, that is what we have studied. But there are two areas in which we find these nerve cells, and we don't say that as nerve cells because their function is not as a nerve cell. That's the reason we don't say it as a nerve cell. Number one is posterior pituitary gland. We all know what is pituitary gland. It is the master gland where many hormones which are released from pituitary gland, from anterior lobes, more than 6 hormones, and the posterior lobe, 2 hormones which releases from these 2 lobes, and it controls almost maximum number of body organs. Okay, so when we talk about pituitary gland, especially the posterior pituitary gland, where from hypothalamus, hypothalamus is a part of CNS. Okay,
Yes.
from there the releasing hormones which releases from hypothalamus because of this stimulation, these lobe where it stores, it doesn't secrete. The secretion is from hypothalamus, but it stores 2 types of hormones. In that, what is the 2 hormones? One is oxytocin, another is vasopressin. So these 2 hormones which are released from posterior pituitary gland, but it is just a storage. It has all the tracts. That here itself is a new nerve cells, but the function is here different. It stores and releases. So this is the one. The second one is the adrenal gland. Now we are coming to our thing. Adrenal gland. What is this adrenal gland? Adrenal gland is a gland which is present above the kidney. So which has cortex and medulla in it. The medulla part, this is very important for us because medulla part has chromaffin cells. So these chromaffin cells are the nerve cells. But we don't say it as a nerve cells because it is not conducting. Something like neurons, what the function of our brain cells or the nerve cells does. But this secretes a hormone called adrenaline. So dopamine, then noradrenaline and adrenaline. This is what from tyrosine the synthesis of adrenaline takes place. So this is very, very important for our even as a neurotransmitter also. So this adrenaline which is released from medulla of the adrenal gland. Okay. So these cells, chromaffin cells and the posterior pituitary gland cells acts as nerve cells because they have direct connection with the nerves. The extension of neurons here is called chromaffin cells. So this part is very, very important. So what happens? We know that the adrenaline is released. And what is adrenaline? We all know. Adrenaline is a sympathomimetic or sympathetic stimulation. It is because of adrenaline. What is sympathetic stimulation? Whenever we get a sympathetic stimulation, it is fight or flight. We want to fight with the situation, or we want to get emotional. All that excitation, whatever the extra work we do, any exercise we do, adrenaline is released. That means it is sympathetic is for fight or flight. Whenever we want to rest or digest, then parasympathetic comes. So now sympathetic is adrenaline. Here what happens, sometimes the tumor of adrenal medulla takes place. Due to the tumor, we all know that the adrenaline means sympathetic. Sympathetic means excitation. So excitation means what happens to blood pressure? What happens to heart? Heart rate increases, blood pressure increases. So the increased blood pressure, because if it is secondary, then if we know with the adrenal medulla, then we know that there is a tumor, thereby more adrenaline is releasing and causing the hypertension. So we need to treat here for adrenal medulla to decrease the hypertension. So this is secondary. And also we have another one called coarctation. Coarctation means the aorta, it is congenital also. Sometimes gets constricted. The aorta gets constricted. Due to this, the pressure increases. With the starting itself, starting of the pipe from where the pump is attached, there if we press it, the whole thing gets increased pressure. Wherever to whichever the tap we give the water, but the starting one if we give pressure, everywhere there will be pressure. So likewise here also, usually the blood pressure will be a cause because of the constriction of aorta. Could also be a secondary cause. So in that way, and there are many risk factors for hypertension. The first is the age. In age, what happens when a person works, the pressure keep on increasing. So as the age passes, pressure increases. That's why we always say to have exercise, to have healthy diet, to maintain stress-free life. So all these, why we say to go with the exercises, because the pressure has to be maintained. So range, I'll tell you, as the age passes up to 65 years, if a person can maintain his pressure, that means after 65 years the pressure will not increase. That's a very good thing. It's a scientific study which has done, because whatever the points which I am collecting, so those points I am stressing. Even now I am going to start a new thing, that is why I entered as a pharmacologist into electrohomeopathy is because there is much more things here to go with the research. So with these patent things, with the whatever the remedies which we have, I am going with the research on that. So shortly I am going to start collaborating with our lab. I need you people's pray for me to go with this, because I am going to do a very big thing. So what exactly I am doing? Because when we talk about electrohomeopathy, we never talk about receptors. We never talk about enzymes. These are the things which alters the body. So how this is altering? Is there any enzyme induction or inhibition with our electrohomeopathic drug? Nobody said that. So that is what my study will be. So with that remedies, I'm going to start and making the patent for each and every product. So my aim is to have minimum 50 patents starting, then I'll go up to 500 patents. So with the scientific evidence, that is very, very important. So by having scientific evidence, is there any enzyme change, enzymatic change? How these electrohomeopathic drug, whether it is going inside the cell or not, Whether it is lipophilic or hydrophilic, we don't know. We know only the cause. We know only the result. We are getting the good result. Yes, we are very happy. How we are getting? Because to get a recognition, we need to have a lot of work to do. And that work I am starting now. So with that efforts, maybe in our next generation, there will be fruitful result for electrohomeopathy. First thing, as we have entered into electrohomeopathy, we are proud to say that we are electrohomeopathic doctors, because whether the government recognizes or not, we have to recognize ourselves first. Self-satisfaction. To have that self-satisfaction, we have to initiate and to understand what the subject is and how depth we are and how good we are. So once we know these two things, the things will become very easy for us. Whoever comes, we will stand and we will fight and we will ask, we will talk, we will tell them, yes, this is also a pathy where it has its own things, where we have to have our research papers, SCI index and Scopus index. We have good impact factors of very good journals. So we can also have our patents in these indexes. We can do that. We'll do that, and hope so that we will go. But right now we'll come to the basics where I was regarding the age. What I was telling, because after 65 years, the elasticity of blood vessels will not be there. So as the elasticity is constant, the pressure will be constant. So thereby the chances of getting increased blood pressure will not be there. This question, if you ask to any MBBS, cannot say about this answer. But we have answer, so it is good for us. Okay. Then, second is the family history. See, in family history, like for our parents, any one of our parents, our grandparents, if they have blood pressure, there will be chances of getting blood pressure. So we have to go with our traditional way to maintain, to balance our things. So family history is also a very important risk factor. One has to have a blood pressure. And then obesity. Directly it affects the obesity, because we need to have more and more blood, because here the cell number is not increasing. In obesity, the cell size is increasing. The fat cells which are increased in its number, a person can have more fatter. Okay, as the surface area increases, you need more and more blood. So to pump that much of blood, the work of heart increases, contractility increases, in turn blood pressure increases. So this is also another factor. Then tobacco smoking. We always say that tobacco smoking is injurious to health. Even the pictures have come in the packs of cigarettes. What is the cause? How we are getting increased blood pressure with the tobacco? Because tobacco directly affects the nicotinic receptors. Irrespective of sympathetic or parasympathetic, the first ganglia always secretes acetylcholine. So in turn, as the acetylcholine increases with NN receptors as nicotinic receptors, thereby the autonomic nervous system exaggerates. And due to that, there is direct effect with the sympathetic, as the sympathetic nervous system increases, thereby the blood pressure increases. So smoking is injurious to health, right? And then we have diet. Even the diet also, which if we have our fatty meals every time, any junk foods, we always, because we don't have time, we go with Zomato or whatever it is, immediately order, get burger, pizza and other things, go with that and go for work. No, that whatever the diet which we are taking. So yesterday only I have seen a video where a person has said that whatever the living things, living like vegetables, fruits, all that have living cells. So if we eat our living cells, our body will be maintained. Like biscuits and other things, which will not give life, which will not have a living cells. So in turn, those things which doesn't have the packed foods where artificial colors and flavors and making it to have more shelf life, the things which we are adding is carcinogenic. So where we are getting more and more cancer nowadays, it is because of that reason. So always we should have a healthy food, that too our living cells is very, very important. Then apart from that, alcohol. So what alcohol does? Alcohol directly has a connection with hypertension, because alcohol increases the metabolism of the liver. It directly has effect on liver, because alcohol metabolism which makes it to the liver. So as the beta 3 receptors which acts, so in turn that leads to increased blood pressure. And then we have stress conditions. During stress conditions also our blood pressure is increased. How? If we think more, how blood pressure is increasing? Is there any connection? So we need to know scientifically what connection we have, how our blood pressure is increasing. That is, whenever a weaker heart a person has, we never say bad news, any trauma, we will not say to them. They say, even doctors suggest, don't tell that, whatever the thing which has happened, tell slowly one by one. Because there exactly, if we tell anything to a person, his sympathetic, with the emotions, sympathetic nervous system stimulates. Due to sympathetic nervous system stimulation, stress is again sympathetic nervous system. As sympathetic nervous system stimulation again leads to hypertension. This is also another cause. Then we have drugs. Many of our drugs, especially allopathic drugs, which also increases blood pressure. Then apart from that, now we will see the units for blood pressure. What units we have? The unit for blood pressure is mmHg. What is mmHg? Millimeters of mercury. So this is the pressure, right? So this is the unit for blood pressure, mmHg. So if you see for a normal, if you say a normal blood pressure, what range we will see? Always whenever we talk, being a medical person, we have to say in a range. Never say that it is 120 by 80. If you say now 120 by 80, that means we are still kids. We are in schooling, where in 8th standard they write what is hypertension, then they will write it as 120 by 80. So the range here is 110. 110 into 120 is systole. Then the diastole is 70 to 80 is diastole. This is normal range. If you say a pressure which is up to this range, then we will say that it is normal. Then we will say if it is pre-hypertension. What do you mean by pre-hypertension? Means a person who has chances, like for diabetes also we say pre-diabetic. Means the person will have chances of having hypertension. There is no as such drugs treatment for these persons. That is pre-hypertension. Only the control, like how whatever the risk factors we listed, we have to see our risk factors, which we have any changes, we can overcome those things. So in pre-hypertension, it will increase from 120 to 139. From 120 to 139 systole, and the diastole is 80 to 90. It is 80 to 90. So this is pre-hypertension. Then we say stage 1 hypertension. Stage 1. In stage 1 hypertension, which is from 139 to 140 to 159, then it is called stage 1 hypertension, where it is 90 to 99. Then we say that it is stage 1. Then comes stage 2. In stage 2, it is above 160. Above 160, and this range is above 100. Diastole is above 100 and the systole is more than 160. Then we will say that it is called stage 2. And then we say hypertension crisis. Hypertension crisis. We say food crisis. Many things, whenever we say crisis is a dangerous situation. So here the dangerous situation in which much more, that is the very important with this, as to stage 2 and the hyper crisis, the difference is this will be sudden, and it will be more than 160, like 160 more than, but it is not constant. So it goes above 200 also. But in crisis situation, we have, it is an emergency situation. We have to have to decrease the blood pressure first without asking the patient whether it is primary, secondary, whatever the causes, things, all that are separate. So immediate treatment for hypertension crisis where it is more than 160 and more than 110 or more above 110 also, because I have seen a patient with having 120 also. So this is about the values and the unit of hypertension. Now controlling mechanism. How we can control hypertension? As I said, there are two things. One is the blood flow, that is cardiac output. Another is the peripheral vascular resistance. By knowing these two things, we can know that controlling mechanism. Even our body also has controlling mechanism. So God has created the beautiful thing of His creation is whatever the thing which we have any alteration, there is a even controlling mechanism for that by the God itself. There is no treatment for that. There is no need to have any treatment. What is that mechanism? So with which it is getting altered. That is also by two types. One is by having baroreceptors. How many of you have heard about baroreceptors? Baro means what?
Barrier.
Baro means pressure. Barometer we say, right? Measuring the pressure. So baroreceptor. There are some protein, some signals which our body gives for that particular thing. Like here baroreceptors means the receptor, the protein molecules which measures the pressure. Is there any difference? Immediately it sends the signals to the brain to telling that there is a change in the blood pressure of a person. So it is present in two parts of the body. One is it is present in the blood vessel, especially the aorta. In the arch of aorta, baroreceptors are present, and even in the carotid sinus, in the carotid artery also we have baroreceptor, because brain needs oxygen. It cannot wait more than 4 minutes. A person will die if the oxygen is not provided. So baroreceptors, which maintains by itself the controlling mechanism. And the another one is the renin system, RAAS, renin angiotensin aldosterone system. This is the one beautiful mechanism which our God has made. If at all there is any alteration, it can be reversed back. So that is the two ways in which one can even by itself, without having any drug interference, his blood pressure can be maintained. If you run from here to 2 kilometers, we get more excited, where shortness of breath, muscle cramps, many problems, we get fatigue, we get so much weakness. After a half an hour, we get normal. How? Because of these mechanisms, which makes our body to get adjust, and homeostatic mechanism having with these two, RAS and the baroreceptor, it can turn back. Now, How these baroreceptors makes its way to control the blood pressure? That is, act by changing the activity of sympathetic nervous system. So baroreceptors are the receptors which has control the nervous system, wherein which the sympathetic activity can be controlled by knowing the signals from baroreceptors. Like if the blood pressure is decreased, also baroreceptors will know that the pressure is decreased. As it passes the blood, these receptors will sense the pressure of the blood. So if the blood pressure is decreased, they activate the baroreceptors, and thereby sympathetic activity is increased and parasympathetic activity is decreased. So it is always dynamic equilibrium. So as the sympathetic activity increases, the blood pressure again comes back to normal. If it is decreased, it will come back to normal. There is one more from heart also. If the increased blood pressure, which also controls, that is ANF system, that we will see later, because we are talking about only the hypertension, that is the blood vessels. Then if the sympathetic activity increases, vasoconstriction takes place. So decreased blood pressure, sympathetic activity increase. Increased sympathetic activity leads to constriction of blood vessels. Due to constriction of blood vessels, the blood pressure increases. It increases because the cardiac output is increased. Again, we are now controlling mechanism either by cardiac output or by peripheral vascular resistance. So here, if the blood pressure decreases, cardiac output increases because of sympathetic activity. Thereby, the blood pressure become normal. Then renin, angiotensin, aldosterone system, what it does? Renin is a hormone and also it is an enzyme. We can call it as both. Why we have to call renin as a hormone or an enzyme? What is an enzyme and what is a hormone? We need to know this basic thing. When we know the basics, then it is very easy to learn deeper things. Because when whatever I am saying, the same thing you may get in a textbook also. But the difference is we have to see wherever the point where we have to highlight it so that we will never forget that thing and we can answer it well. If the question is asked whether the renin is an enzyme or a hormone, you go with a Google, you will get somewhere as a hormone and somewhere as an enzyme. You will be confused because you don't know the basics. So if you know the basics, hormone is one which is released from an endocrine gland, right? We are all knows that. And the hormone never works on that area where it is releasing, because it is circulating in the blood. It's a ductless gland, right? There is no duct for an endocrine gland. So without having duct, the hormone, the secretion, whatever is released, directly it goes into the blood. From the blood, it will go to the target site. There the action will be there. That is an hormone. Renin is released from juxtaglomerular cells of a afferent arteriole which is present in the nephron, in the kidney. So from there, if the renin is released, renin is traveling in the blood and it is converting, because in the presence of angiotensinogen to angiotensin 1. So where it is happening? It is somewhere else. Hence it is an hormone. Because why it is called enzyme? Even the renin which is released will act on the efferent arteriole and the efferent arteriole so that there will be vasoconstriction. So vasoconstriction is taking place whenever the blood pressure is down. So that is an enzyme. So it could be a hormone or an enzyme. So with the renin release, again automatically the blood pressure increases. So very good thing for us to understand the drugs. If we control the renin, what happens to our blood pressure? Renin is increasing the blood pressure. Now we are giving a drug to decrease the renin. What happens to the blood pressure? Blood pressure decreases. Very good. So we can have a drug by decreasing the renin. So one class we came to know. We can give a drug where sympathetic activity can be decreased. If you decrease the sympathetic activity, what happens to the blood pressure? Decreases. So we can give that. Very easy. So in that way, we have to learn how to give a drug, right? And then so low sodium intake to high sodium loss, it releases the renin,